You know, it's kind of funny how you look at some really common things in animal care, stuff that seems totally routine, but when you actually dig in, wow, the complexity is just incredible. You think you understand something, then boom, a whole new layer unfolds. So today we're doing one of those deep dives into something that maybe sounds super specific, bovine frontal sinusitis. Yeah, an infection. Sounds straightforward enough, right? But looking into it really shines a light on, well, animal welfare, how we manage livestock, even the economics of it all. Our mission here is to take this stack of expert reports, all this research, and just pull out the absolute key takeaways for you, like a shortcut, Get you up to speed on something you might not have realized you needed to know, hopefully with a few aha moments along the way.
That's exactly it. And the source material, I mean, it is detailed, very scientific, sometimes dense. But what's fascinating, truly, is seeing how seemingly small decisions, or just the way an animal is built, can trigger these big biological consequences. It turns a minor thing into a real health challenge. We're definitely going beyond just the surface level here.
Okay. So to really get this, we need to start right at the beginning. The skull itself, the actual anatomy of cattle. So they have 6 main pairs of these paranasal sinuses, but the one we're really focusing on, the frontal sinus, it's the biggest. And the most important clinically, especially when things go wrong after procedures, like dehorning. And here's where it gets really interesting. This frontal sinus, it's not just like a simple empty space. The reports describe it as an extensive labyrinthine structure. You think like a maze inside the bone. Super complex. It's split into front and back compartments, rostral and caudal. And then those are divided up even more by all these irregular bony and soft tissue walls, septa they're called. And there's a complete wall down the middle separating left from right. So definitely not one big room you can just easily, clean out.
Exactly. And that structure, that complexity, is, well, it's basically the root of the problem. All those little nooks and crannies, they create these isolated pockets of infection. Once you get pus, that thick, purulent stuff building up in there, it's incredibly hard for the body to clear on its own. And standard treatments often just can't reach everywhere effectively. It's like, trying to drain a maze through one tiny pipe that gets blocked easily.
Perfect analogy. And then adding to that challenge, there are these 2 critical extensions of the frontal sinus that really matter here. First is the cornual diverticulum. This is basically a part of the back section of the sinus that extends into the bony core of the horn itself. It pneumatizes it, fills it with air, and that direct connection is precisely why dehorning older animals, mature ones, invariably results in a sinusotomy. You're literally opening the sinus right up to the outside world, a direct path for contamination.
Right, a direct entry point.
And the second one is the postorbital diverticulum. This bit is tucked away right behind the eye socket. Its location and shape make it a really common spot for pus to get trapped, sequestration, and retention, the reports call it. And because it's tucked away back there, it's super challenging for vets to get in and flush it out properly during treatment. So, that often leads to treatments failing.
It does. Now, there is a natural drainage system, technically. Small openings, fenestrations into the nasal passages, the ethmoid meatuses. But like we said, that system is just easily overwhelmed and obstructed when you have thick pus and inflammation. It just can't cope. Which leads us to the really critical question, doesn't it? If the anatomy itself sets the stage for problems, what are the specific things we do that make it so much worse?
Exactly. And the answer, well, it really boils down to the animal's age. There's this really precise developmental timeline for how horns form. The sources really hammer this point home. So when a calf is born, the horn buds are tiny. They can move around a bit, not stuck to the skull yet. But then, around 2 months old, those buds fuse to the skull bone, the frontal bone. And after that, usually between 3 and 6 months old, that frontal sinus starts to expand, to grow right into the base of that now attached horn, forming that cornual diverticulum we just mentioned.
And that whole sequence creates what the reports call a critical window of opportunity. It's so important to get this distinction right. Disbudding. That's done before the bud attaches properly, and crucially before the sinus grows into it. Ideally, before 8 weeks old. It's basically a superficial procedure. It does not breach the integrity of the skull or sinus, much less invasive.
Okay.
Whereas dehorning, that's done after those things have happened, after the attachment, after the sinus invasion. It's an amputation, plain and simple, and it creates an open communication with the frontal sinus. So that fundamental anatomical shift, it just completely changes the game. It goes from a minor procedure to something invasive with a significantly higher risk of serious complications, especially sinusitis. The age of that animal becomes truly the single most important determinant of procedural risk. It's that stark.
Right. So dehorning older animals, way riskier. But look, it often has to be done for safety, for herd management. So what methods are actually used and what are the specific, risks and benefits for each? Our sources lay out 5 main techniques. Each one's kind of a balancing act, right? Between getting the job done, cost, welfare, and avoiding these complications. Okay, first up, chemical disbudding. Using caustic paste. This is for really young calves, like the first couple of weeks. It's bloodless, which sounds good, but the reports warn about a high risk of collateral tissue damage, like the paste running into the eyes or onto the mother cow's udder. And it doesn't always work perfectly. Sometimes you get scurs, these little deformed horns going back.
Yeah.
Not ideal. Then there's thermal disbedding, the hot iron method. This is preferred for calves maybe up to 12 weeks, also bloodless. And it cauterizes, seals the wound, so the infection risk is lower. Seems better.
It generally is, but there's a but. You have to be careful. Excessive heat or prolonged application that can actually damage the bone, potentially even lead to meningitis if the heat gets through to the brain tissues underneath. So technique matters a lot.
Okay, technique is key there. Now, what about older calves? Once that horn's attached and the sinus is involved, that's when you get into physical or amputation dehorning. Using tools like scoops, Barnes dehorners.
You have the more traditional methods for slightly older animals.
Right, and these create a significant open wound. Big risks here: bleeding, lots of pain, flies getting into the wound, and critically, direct contamination of the exposed frontal sinus. That's our main pathway to sinusitis right there.
Plus, something maybe people don't think about is disease transmission. If those tools aren't cleaned and sterilized properly between animals, you can spread things like bovine leukosis virus, bloodborne stuff.
Wow, okay. That's a big one. What's next? Surgical or cosmetic dehorning. This sounds more controlled, right? Done by a vet, they suture the skin closed afterwards. Supposedly faster healing, aseptic technique.
Yes, it aims for that. But here's a really interesting kind of counterintuitive risk the sources highlight. If you suture that skin flap closed, but there are some contaminants trapped underneath, maybe from the procedure itself or just the environment, well, now there's no drainage. You've basically created a perfect, sealed environment for an abscess to form inside the sinus. And that can lead to a much more severe, much harder to treat sinusitis because everything's trapped.
So sealing it up can actually backfire badly.
Yeah.
Okay, and the last one.
Horn tipping. This is usually for adult cattle, just taking off the very end, maybe the distal 1-2 inches.
Less painful, presumably.
Generally, yes. And crucially, if you do it right, just the tip, it does not expose the sinus.
Ah, okay.
But it's less effective at stopping bruising between animals, which is often a reason for dehorning. And you can still cause sinusitis if you accidentally take off too much horn and breach that sinus cavity.
So even that has risks if not done carefully.
Absolutely. And just to bring it back to age again, because it's so central, the scientific and clinical evidence is unequivocal. Dehorning older cattle significantly increases the risk of complications. One study found the sinus was exposed in over 40% or 40.6% of dehorned animals. That's a direct result of doing it after that sinus is extended into the horn.
40%.
Yeah.
Wow.
And that really makes you wonder, doesn't it? Beyond just opening the sinus, how does all the stress and the significant pain from these more invasive procedures affect the animal's immune system? Does that make them even more susceptible to infection setting in?
That's a really critical point, the stress factor. Okay, so let's say the worst happens. You've got an open sinus, maybe from dehorning an older calf or heifer. What happens next? How does the infection actually develop? Our sources call post-dehorning sinusitis a direct iatrogenic disease, which basically means it's caused by the procedure itself, right?
Correct. It's an unintended consequence of the intervention.
So you breach the skull, you open that sinus, and suddenly this normally sterile area is exposed to everything in the environment: dust, dirt, manure, flies, and even bacteria that normally live on the animal's skin without causing problems. They all get introduced right into the sinus.
Yep. And this gives opportunistic pathogens their chance. These are bacteria that might be around normally but jump on the opportunity when the body's defenses are down or there's, damaged tissue. The big players usually found are Truparella pyogenes, Pastorella multicida, and sometimes Pseudomonas species too. They just thrive in that compromised sinus environment. It's warm, it's moist, plenty of nutrients from the tissue fluids.
And then the disease sort of progresses in stages.
Usually, yes. You get the acute phase first. That initial contamination causes inflammation. You see the typical signs: fever, the animal's off its food, lethargic, and you'll often see that purulent discharge, that pus, coming from the wound itself or sometimes just from one nostril on that side.
Okay, that's the immediate aftermath. But what if it doesn't clear up?
Right. If it's not cleared, And crucially, if the drainage gets blocked by all that swelling and thick gunk, then it transitions to the chronic stage. And this is where you see that really thick, nasty, inspissated pus. It's almost like dried paste. You get dead tissue debris building up. And often you get these things called bone sequestra, little fragments of dead bone that are broken off the sinus wall. They act like a constant source of irritation and infection. Really hard to get rid of.
Ugh, sounds nasty.
It is. And what's really interesting, or maybe tricky, is what the reports call the temporal disconnect, these chronic signs. They might not show up for weeks or even months after the dehorning procedure.
Months. Wow.
Yeah. So you can see how diagnosis gets difficult, right? If the farmer or vet doesn't connect it back to that dehorning event that happened ages ago, they might miss the underlying cause.
Absolutely. And why is it so hard for the body to clear it once it gets chronic?
It goes straight back to that anatomy we talked about. All those compartments, those septa, and especially that tricky postorbital diverticulum behind the eye, they just trap the pus and debris. There's no effective way for it to drain out naturally once it gets thick and blocked. So you could argue the disease progression, the pathogenesis, is driven almost more by the mechanics, the failure of drainage from this complex anatomical trap, than just by how nasty the specific bacteria are.
So it's like a plumbing problem as much as an infection problem.
Exactly.
Yeah.
It's mechanics and fluid dynamics as much as it is a problem of microbiology. Well put.
Okay, so given that it can show up late and the signs might be subtle at first, how do you actually diagnose this? What do vets look for?
Well, you always start with a history. Was there a dehorning procedure? When was it? What method was used? That context is crucial.
Right. Then the symptoms themselves.
Yeah, you look at how they manifest. Early on, in the acute stage, you might see that one-sided nasal discharge, maybe some fever, bad breath, halitosis. The animal might be off feed, acting dull, maybe showing signs of head pain, like tilting its head or pressing it against things.
Are typical sick animal signs, but maybe localized to the head.
Exactly. But if it progresses, gets chronic and severe, the pressure inside that sinus can actually cause visible changes. You might see a distortion or swelling of the frontal bone on that side.
You can actually see the bone bulging.
Sometimes, yes.
Yeah.
Or you might get exophthalmos. The eyeball on that side starts to bulge outwards because of the pressure behind it.
Whoa.
And here's where it gets really serious, really alarming. If that infection erodes through the bone into the cranial vault where the brain sits,
Oh, no.
then you can see severe neurological signs. Things like ataxia, incoordination, wobbliness, opistotenos, where the animal arches its back and neck rigidly, even seizures.
And at that point,
The prognosis is very, very poor. Grave, usually.
okay, so catching it before that happens is key. What about specific diagnostic tests?
Well, the physical exam is important, feeling for that swelling, heat, or pain over the sinus area. And then there's a really neat, valuable diagnostic technique called percussion, basically tapping firmly over the sinuses.
Tapping the skull.
Yep. A normal air-filled sinus should sound resonant, kind of hollow when you tap it, but a sinus filled with fluid and pus, it produces a dull, non-resonant sound, like tapping something solid.
Ah, interesting.
Comparing the sound on the affected side to the normal side is really important for interpretation.
Makes sense. And then I guess imaging.
Absolutely. Radiography x-rays of the skull are pretty much the cornerstone of diagnosis, according to our sources. They clearly show if the sinus is filled with fluid instead of air, it looks opaque, whitish on the x-ray. You might even see fluid lines. And in those chronic cases, x-rays can reveal bone damage, that bone lysis, or spot those dense bone sequestra we talked about.
So they tell you it's there and how bad it is.
Exactly. Diagnostic and prognostic. They really help guide treatment decisions, especially surgery.
Any other tools?
Yeah, a couple more specialized ones. Sinusitis, which means taking a sample of the fluid. You have to make a small hole into the sinus first, using a special surgical tool called a trephine. Aseptic technique is crucial, of course.
A trephine hole. Okay.
So you collect some of that sinus fluid and send it off for bacterial culture and antimicrobial sensitivity testing.
Ah, so you know exactly which bugs are causing the problem and which antibiotics will actually work against them.
Precisely. Critical information for targeted treatment. And then sometimes, especially in referral hospitals, they might use endoscopy or sinoscopy. They actually insert a small camera through that trephine hole to look directly inside the sinus. Lets them see the lining, the type of exudate, and maybe spot sequestra that weren't obvious on the x-rays.
Wow, okay. A direct look inside. So, you've got the diagnosis confirmed. What does treatment actually involve? You've hinted it's complex, not just pills.
Definitely not just pills. Success really relies on a three-pronged therapeutic approach. as the sources put it. You need all three elements. 1, you absolutely must establish drainage. Create a way for the pus to get out. That usually means surgery.
Right. Makes sense given the blockage problem.
2, sinus lavage. You need to actively flush out all that accumulated pus, debris, maybe even those sequestra.
Okay, washing it out.
And 3, systemic antimicrobial and anti-inflammatory therapy. So yes, antibiotics and anti-inflammatories are part of it to fight the infection throughout the body and reduce pain and swelling.
Got it. Drainage, flushing, and meds.
But, and this is a critical warning from the sources, systemic antibiotic therapy alone is rarely sufficient.
Yeah.
Just giving shots or pills won't fix it usually.
Why not?
Because the drugs just don't penetrate well enough into those big pockets of thick, walled-off pus and dead tissue. You have to get the drainage and flushing done. The prognosis, how well the animal does, is directly tied to how aggressive and thorough that initial surgical intervention is.
Okay, so the surgery is really the key. What does that involve? You mentioned trephination.
Yes, trephination is the cornerstone. It means making one or more holes into the affected sinus using that trephine instrument. It's usually done with the animal standing, just using local anesthetic to numb the area. The exact location for the hole is guided by anatomy and what the x-rays show.
And you might need more than one hole.
Often, yes. Especially for those complex cases, or to get access to difficult areas like that post-orbital diverticulum, you need to ensure you can really drain and flush the whole affected area.
Okay, so you make the holes, then the flushing, the lavage.
Right after trephination comes sinus lavage. This is usually high-volume lavage, meaning using a lot of fluid.
Yeah.
Warm, sterile saline is common, or maybe a very dilute antiseptic solution like povidone iodine. You flush it in through the trephine hole, trying to mechanically break up and wash out all the gunk. Ideally, you want to see it flushing out through the hole and maybe even starting to come out the nostril on that side as the natural drainage pathway clears.
And you have to do this repeatedly.
Oh yes, it has to be done daily until the effluent runs clear, meaning until the fluid coming back out isn't full of pus anymore. Could take days, even weeks in bad cases.
Wow, intensive. And what happens with the holes? Do you stitch them up?
No, usually not right away. For postoperative management, those trephine sites are generally left open specifically to allow continued drainage. They're often protected with something called a stent bandage, which is basically a setup that keeps the hole open but covered and allows for easy access for the daily flushing.
I see. So surgery and flushing are the main event. What about the meds?
They're the crucial support act. Antimicrobial therapy, these systemic antibiotics, are important to control the infection that might have spread beyond the sinus, or just to help overwhelm the bacteria. Ideally, the choice is guided by those culture and sensitivity results from the sinusentesis sample.
Right. But while you're waiting for those...
While waiting, vets often use empirical choices, broad-spectrum antibiotics that are likely to be effective against the common culprits. Things like procaine, penicillin, or oxytetracycline are mentioned.
Okay. And the anti-inflammatories.
Also vital. Anti-inflammatory therapy using NSAIDs, non-steroidal anti-inflammatory drugs like flunixin, meglumine, or meloxicam does several things. It reduces pain, brings down fever, and helps control the severe inflammation within the sinus. This isn't just about making the animal feel better, which is important for welfare, but it also helps encourage them to eat, which aids recovery.
So a really multifaceted approach. Drainage, lavage, antibiotics, anti-inflammatories. It sounds like a lot of work and potentially expensive.
It is. Treatment can be prolonged and costly.
Which brings us squarely to prevention, doesn't it? Given how nasty this condition is and how tough it can be to treat. What's the best way to just avoid it altogether?
You nailed it. The sources are absolutely unanimous on this. The most effective, economical, and humane strategy for managing post-dehorning sinusitis is prevention. Full stop.
And the #1 way to prevent it?
The core principle is simple. Avoid invasive procedures that open the frontal sinus, particularly in older animals where the risks are substantially higher. It all comes back to that critical developmental window.
So practically speaking, what does that mean for dehorning practices?
#1, absolutely top of the list, earliest possible age. Disbudding calves between 2 and 8 weeks of age is the single most effective measure. Period.
Because before 8 weeks.
Before the horn bud is fully attached, and crucially, before that sinus is extended into the horn base. The procedure is just fundamentally less invasive and far safer. You're not breaching the sinus.
Okay, timing is everything. What else?
Strict hygiene. Seems obvious, but critical. Equipment must be cleaned and disinfected between each animal. No exceptions. That prevents spreading pathogens from one calf to the next.
Right.
Then control the environment. Do the procedure at a clean, dry area. Avoid doing it in wet weather or peak fly season. Why? Because mud, moisture, and flies massively increase the risk of contamination getting into that wound site.
Makes perfect sense. And one more thing that seems really important, pain management.
Absolutely crucial. Multimodal pain management. Using both local anesthetic, like a corneal nerve block, to numb the horn area before the procedure, and giving systemic NSAIDs for longer-lasting pain relief afterwards.
And this isn't just about being nice to the animals, is it?
Not at all. The sources frame it as both an ethical imperative and a sound management practice. Less pain means less stress. Less stress means the animal's immune system isn't as suppressed. They handle the procedure better, they get back on feed faster, and they're likely less susceptible to secondary infections like sinusitis setting in.
So that small upfront cost of analgesia is a sound investment compared to treating chronic sinusitis down the line.
Exactly. It pays off in animal health, welfare, and even economically.
Oh, okay. So early disbudding, hygiene, environment, pain control, that covers optimizing the procedure itself. But is there an even better way, a way to avoid the procedure altogether?
There is. And it's the ultimate preventative strategy, polled genetics.
Naturally hornless cattle.
Precisely. Breeding for animals that are genetically polled, meaning they just don't grow horns in the first place. This is described as a permanent, non-invasive solution. It completely eliminates the need for disbudding or dehorning, and therefore totally removes all those associated risks we've been talking about. Pain, stress, bleeding, infection, sinusitis.
It just takes the whole problem off the table.
Completely. And looking at the bigger picture, with growing consumer interest in animal welfare, market demands for products from high welfare systems. The sources suggest that adopting polled genetics isn't just a better animal health strategy. It's also seen as a forward-thinking and sustainable business practice. It aligns with where the industry and consumer expectations are heading.
Wow, what a deep dive that was. We really went from, the basic skull structure, that incredibly complex maze-like sinus.
Yeah, with those crucial extensions into the horn and behind the eye.
Right. To understanding how that specific developmental clock, when the sinus expands, makes age the absolute critical factor for risk. Turning disbudding into the much riskier dehorning. We looked at all the different methods, uncovering those hidden dangers like chemical burns or even creating a sealed abscess with cosmetic dehorning.
And how easily infection takes hold, progressing from acute to chronic, driven as much by the trapped pus and anatomy as by the bacteria themselves. That temporal disconnect, too.
Exactly. And then through diagnosis, the tapping, the x-rays, the intensive three-pronged treatment,
Drainage, lavage, meds.
finally landing on prevention. The absolute power of early disbudding, good hygiene, pain relief, and ultimately the elegance of polled genetics as the final answer.
It's really something.
For me, the big aha moments were really grasping how that developmental timing turns a simple procedure invasive and realizing the sinus structure itself is such a major player in chronic disease. It's not just about the germs.
Yeah, me too. And I was just fascinated seeing how all these different fields, anatomy, developmental biology, microbiology, surgery, even genetics, how they all have to come together to really understand and tackle this one single, but pretty significant animal health issue. It shows how interconnected everything is in biology.
It really does. So here's a thought to leave you with as you go about your day. Thinking about these intricate details, the biology, the procedures, how might that understanding change how we look at other practices in animal care, maybe even in human health? What other things that seem simple on the surface might actually have these hidden, complex biological consequences that maybe we're not fully appreciating yet? Something to think about until our next deep dive.